we visit with our St. Vincent doctors. We oftentimes take your phone calls, and today it's about something a little different, healing from wounds and a wound care center. And Dr. Gary Villines is in from St. Vincent Wound Care Center. Good to see you.
Thank you.
Yeah,
It's nice to be here.
If you have any questions, go ahead and give us a call at 1-866-GMA-TALK. But in the meantime, we're going to talk a little bit about this. Why do we need a specific wound care center? What happens there?
Well, wound care has become a specialty in its own in this country over the last 10 to 20 years. And it's because we have an aging population with an ever-increasing number of diabetics. And if you had to bet on it, the next patient that comes through our door is going to be a diabetic, because they're the ones that have the most problematic wounds. And wound care, you know, in the past, it's usually been taken care of by your family physician or general surgeons, and it's time-consuming for an office visit. At a wound center, we specialize and have nurses that specialize in wound care. That's all we do. And we have specialized dressings and advanced technologies that are not available to most physicians. And it's just, I kind of consider it that there's a wound epidemic in this country.
Really?
And I mean, every year there's just millions and millions more people presenting to wound centers.
And is it the older we get as well? Is it harder for us to heal?
Yes.
Okay.
It's an aging population and diabetes that's driving the whole problem.
Those are the two things. All right, we do have somebody on the line who wants to ask you a question. Ronnie is up first, and he's from Star City. Hi, Ronnie.
Hello.
Hello. Go ahead. What's your question?
Okay, my question is, I have feet. I'm a paraplegic, and on my toes, my toenails, I've been paralyzed for 24 years, and toenails, they tend to, I've torn them off, and they're looking bad. And you know, I don't have diabetes or nothing, but I mean that I know of, and that they've tested me for it. But I mean, they're like, just, I would like to know, does he have any creams or something I'd be able to put on there to help it to heal?
Okay.
Well, if it's primarily a toenail problem and you don't have any wounds associated with it, you probably are better off finding a good podiatrist in your area. People without sensation in their feet, especially paraplegics and diabetics, probably should have their toenails trimmed by a podiatrist. We don't do that at the wound center. Occasionally wound centers do, but we don't. But a good podiatrist can safely trim your nails without injuring your feet.
Okay, very good. So that may be the place to go. Thank you, Ronnie. Ben is up next. He's right here in Little Rock. Hi, Ben.
Yes.
Hi.
I have a question about a hernia that I'm scheduled for evaluation for surgery a little over a week from now. And it's about the size of half the size of an egg in my right side. And I'm wondering, how should I do, you know, just walking around, how should I conduct myself until I get evaluated?
Well, for hernia, you know, the only way you'd probably end up in a wound center is sometimes one of the common things that we take care of is that if somebody had surgery and they have problems healing their surgical wound, they get referred to a wound center. But to answer your question, you should, until you get it repaired, you should try not to overstrain. A small hernia like that, if it bulges out and becomes extremely painful, is an emergency, and you need to go to the emergency room.
Okay. Sounds like he's scheduled for surgery, so he just needs to take it easy until then.
Correct.
And do you get a lot of people post-surgery who perhaps, you know, their scars are not healing like they thought they would? Is that another client that you have in there?
Yes.
Yeah.
That's down the list of wounds we see. That's in the top 5. Is that patients who's had failed surgical wounds, or compromised surgical wounds, we call them. And that's not uncommon, and it's not the surgeon's fault. It's just the fact of our society, especially with increasing numbers of resistant bacteria causing wound infections. So if we see a post-surgical wound, it's usually related to infection and the wound margins separating.
Okay, well, now you know that there is a special place if you have any of these problems, especially for diabetics. The St. Vincent Wound Care Center is there to help you. Here's the information on your screen where you can find Dr. Villines and the rest of the staff, information on how to call and their hours as well. Thanks for coming in. I think a lot of us didn't realize you guys existed.
Oh, you're welcome.
But it's
Thank
good
you very
to know
much.
that you're here if we need you. Thank you, Dr. Villines.
You're welcome.
All right. Back